Pediatric asthma is a huge problem in that it's the #1 cause of missed school days for children. It's a very big cause of morbidity where children limit their activities or what they can do. It's shown nationally that 3 out of 5 kids with asthma will have an attack during the year, which puts them at risk of bad outcomes and again, having to cut way back on their activities. It's the #1 cause of hospitalization. And the reason it's such a big deal is because asthma is a treatable illness and it's a preventable illness. And so these are outcomes we don't have to be having. So UT Health Northeast is collaborating with the Christus St. Michael's program in Texarkana. And between the two programs, they have an asthma bus like we do. They have a specialty trained team like we do. They go out and follow the same principles that we do.
Our program is unique in that we come to the patient. We make it easily accessible, especially in some of the small towns that are miles from a clinic or health care. We make it easier for the parent to attend with the child.
The biggest challenge that I see with children that their asthma is not managed is they're missing a lot of school, or they're missing activities because they can't, catch their breath just to play outside or participate in PE.
When a patient comes into the room, the patient goes back and visits with their nurse, and a nurse does a pulmonary function test. That's a spirometry. Spirometry is not something you'll find at every primary care clinic, and it specifically manages lung volumes and lung speeds. Once we have a pulmonary function test, we bring the patient back to the exam room, and in the exam room we do a head-to-toe physical. If we determine that these patients have allergies, then we do a tremendous amount of teaching. Nothing is more important than teaching how to identify the signs and symptoms of asthma, how to identify the triggers of their asthma, and how to treat their asthma.
In the 1.5 years that I've been working with it, I have seen so many children that have not realized they weren't able to breathe. And they come on the bus and they get the opportunity to do the pulmonary function test and then go back and see the nurse practitioner. And then they realize that there is hope and help out there for them.
The students that I have that go to this program, when they learn to manage their asthma, they are so genuinely excited. And they'll come to me and say, Nurse Graham, guess what? I'm taking my inhaler in the morning the way I'm supposed to, or I'm taking it at night, or I'm taking my pills, or guess what, Nurse Graham, I went to PE and I didn't wheeze this time, or guess what, Nurse Graham, I feel so much better. And I can't tell you how many parents I have had come through and be so gracious and so thankful for this program.
A phenomenal aspect of our program is not only do we treat you, but after you've left the clinic, then we follow up with you. And so you'll get a call in a number of weeks and we'll make sure, how are you doing? Do you understand your plan? Are you meeting the goals of your plan? Do you have any questions we can help you with? And I think that follow-up and that encouragement with families really keeps them on track and keeps them believers in the plan.
Our partnership with Christus St. Michael is strong. And what we've shown through this project and through this process and partnership is that this model can be replicated. Every day we are expanding into new schools. We are meeting new nurses. We are touching more lives. And what's being done in Northeast Texas can be done in Southeast Texas, in Northwest Texas, and anywhere across the state. The program works and the opportunities are unlimited.
The reason the waiver is such an important part of our program is without the waiver money, we were not able to fund going out regularly. With the waiver money, we have been able to go out and already in the first year see and treat over 1,000 children. And our goal with the waiver is to try to reach several thousand children. And that several thousand children we have the potential to positively impact, where we can hopefully get them to be healthy, normally functioning kids. And without that money, then that several thousand East Texas children we're not going to reach. And those are kids that may stay restricted and have bad outcomes. And I look at that as a tragedy.
If it wasn't for the UT Asthma bus, I don't even believe my son would be here today. I was consistently taking him to the emergency room. He was having an extremely hard time breathing. He's playing now, and while he's at school, I'm enjoying him being able to play and do his activities and his learning at school, and I don't have to be stressed out about coming to get him, to take him to the emergency room.
Before I couldn't play football, couldn't run, do anything, but now I can. Because of the bus, it feels like I'm not even sick anymore. It's like I don't even have asthma anymore.